This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome live to Dr. Tom Roselle. As you can tell, this is not him. This is Dr. Stephanie Pina, and I'm standing in as Dr. Roselle is off on a teaching tour around the country, educating those that will be the future practitioners and also the public. We have an interesting show for you today, a little different format. I don't even think the studio has dealt with this before with us, but we're going to talk about something that is near and dear to my heart. And, of course, we're going to be taking your calls, too, so if you want to call in, the number is 1-888-630-9625. And what we're going to talk about is something that is very effective as far as treatment, healthcare for the whole body, that doesn't involve drugs and surgery. But the amazing thing is the World Health Organization actually put together a list of all the different things that can be used to treat, including sciatic pain, tennis elbow, knee pain, headaches, dental pain, TMJ, essential hypertension, depression, peptic ulcers. All this and more is actually covered by acupuncture. And you've heard us talk about this for quite a while, but this time it's not just me talking and it's not just Dr. Roselle. I've got a great board here that's going to basically help us get through this, so you have multiple people to ask questions to. In studio live here, we have the Acupuncture Society of Virginia board members who are going to introduce themselves, but we have a board here that basically is going to be able to talk about acupuncture with you so you have a better understanding of what's going on and how acupuncture can help you. So let me just start off by having them introduce themselves.
Hi, I'm Kathy Heidemann. I'm a board-certified acupuncturist as well as a nationally board-certified nurse practitioner. So, and I'm the legislative liaison for the Acupuncture Society Board.
Hi, I'm Sarah Shoup, and I am a licensed acupuncturist in Virginia, and I am the ASVA president.
Hi, I'm Carol Whitmire, in charge of membership here at ASVA, and also a physical therapist.
Hi, I'm Joni Stewart, licensed acupuncturist in Virginia. I'm also a craniosacral therapist.
So as you can see, we have a great board here today to answer any questions. And also what we want to think about, too, is, as you just heard, everyone's coming from a different background. So you have practitioners who have been involved with Western medicine practicing acupuncture, and you're seeing much more of a trend with that in the future. What we want to talk about first is, someone give me a basic, brief overview of what acupuncture is and how it's become so more popular lately and is more available to people.
Okay. The popularity of acupuncture has grown mostly because people have found that it's been effective. In my experience, people have tried everything else first, unfortunately, and they come to us as a last resort. But when so many things in our toxic world nowadays end up failing the patient, that they end up do come to us and find great results. And of course, any medical and healthcare practice grows by word of mouth. You know, it's not like you advertise when you're selling a shirt. It's I went to this person, I trust them, so they tell two friends, and then they tell two friends. So that's how we grow. And so it's been a word of mouth explosion, really, for acupuncture.
Well, the amazing thing is when we even think back to how the U.S. learned about Chinese medicine and Chinese acupuncture from the beginning, you know, that was only in 1972 when James Reston was basically a reporter from the New York Times, and he was over in China and had to have appendectomy surgery.
Exactly.
And they used acupuncture for his post-pain recovery and came back and started writing articles, and that really what got the ball rolling. And it was basically a few years later that the first institutes, and one here, especially in D.C., has really started to grow up and said, you know, we need to put more research into this. We need to basically find out how it works. We need to train practitioners the correct way and make sure that they can develop this over here just like they do in China. So I think you see a lot of information and patients pass that one does well, and then the next one tells the next one, and you say it's all about word of mouth. When we talk about acupuncture, I think one of the things that tends to be a misfire, too, is that there's different terminology and it's a different mindset overall because it's its own system that's very different from Western medicine. Acupuncture is part of traditional Chinese medicine, which also includes its own dietary therapy. It has its own exercise. It has its own lifestyle issues. It has herbal therapies all included into that. So acupuncture and the needling gets most of the glory out of all that. But how do you see that kind of play into more of the Western world as far as the types of patients that are actually coming in to try to experience acupuncture?
Well, coming from a Western and Eastern world, it's interesting. As I've been a nurse practitioner for more years than I'd like to count, and when I went to acupuncture school, I had to drop. We were taught drop what you know and pick up something else. It's a total paradigm shift. It's like studying Newtonian and Einsteinian physics. They don't always meet. So you kind of have to. You have to shift your mind completely, and the goal then is to get the patient to shift their mind as well. And you have to sort of be able to speak both languages. And I don't mean English and Chinese. I mean you have to be able to speak cold foods versus hot foods, and in a terminology that's Western and Eastern. And you have to be able to explain how acupuncture is an energy system versus any other kind of system, so that you can get the patient to understand, because unless they understand, they're not going to follow your therapies.
Right. And when we're looking at the types of diseases and illnesses and conditions that people come in to get treated by, pain still tends to be the number one things that draws them, but then they start to realize there's difference with an acupuncture treatment because what it's doing is treating the whole body. We talk about moving qi and blood a lot, and even this idea of the qi, the energy of body, basically that cell-to-cell communication that is necessary, whether or not you talk about qi as oxygen or you talk about it as that energetics, we need that communication because as we all know that our shoulder is not by itself. It's attached to the rest of our body. When we have digestive issues, we know that can create more inflammation and affect the adrenal glands. We know that it can affect the rest of our digestion, not only from what goes on in the bathroom, but essentially how we're inflamed and bring out more things, especially through our skin, like through the lung channels in Chinese medicine. So a lot of the things that people come in with, they're coming in with those Western diagnoses because they're either not getting any better, they're not seeing results, and they finally say, hey, I'm going to give this a try. Now, one of the great things that I love about acupuncture in general is that, you can do this on all ages of people. You can do this on little children. You can do this all the way up to the older children. But essentially what tends to happen is they come in and it's that fear of the unknown. So as a group of acupuncturists, what do we need to do to help decrease some of that fear and worry about whether coming in, what's the treatment about?
Okay, so in order to decrease the fear, one of the things you have to do is assess your age group. If I'm talking about a little kid, the one thing I have to be careful of is what has the parent planted in them, because in the Western world, parents are very often more afraid of the shots and the needles than the kids are, and so they instill that in the kids, and so we have to undo that. Mm-hmm. And so it's a matter of kids will respond to anything. If you show them, I show them the needles, I show them the little pressure points, I let them hold kind of stuff. So you can get kids to get unafraid of anything if you're straight up with them. And and if you tell them the truth, you know what, you're going to feel that. They'll be fine. The toughest group? Firefighters and police officers. The bigger they are, the faster Absolutely. They go down. And I apologize to all of you. I've taken care of firefighters and police officers all my life in Western and Eastern medicine, and I just find they're tough with needles. They just really are, and I don't have any brilliant ideas on how to get them to calm down.
Well, I tend to think with that particular age group that comes in, and even that body size that comes in, because sometimes it doesn't even depend on their profession, and some of those are the people that desperately need to come in because Absolutely. They have so much work, stress, and strain, and they're physical, what they're doing. So that preventive medicine mode is the perfect thing, and acupuncture is so easy and relaxing at the same time. I think one of the things that ends up coming in is, either we all had that bad needle experience, like we got a blood draw or we had an injection, and that's what's in the back of our minds, just like you were saying with the little kids. What have their parents kind of told them about it? But when it comes to the acupuncture needle, you can spit about 5 to 10 acupuncture needles inside one of those other needles. So it's amazing, the difference. And once they start to realize that, hey, they kind of start to feel relaxed once they're on the table, it's a whole different experience. I always say by the second treatment people come in, they know exactly what they want to do. They know which positions they want. They're practically telling you where they want the needles because they understand that you're there and it's not meant to be a scary experience.
Exactly. And I do use that analogy. You know, it's like I can fit 10 of these into a hypodermic needle, and they're in awe of that, and so that calms them down. But you're right. Once you get them on the table and you explain, you're going to feel maybe some vibration. You're going to feel one needle talking to each other. You may feel some deep warmth. And you tell them what they might feel, and you don't use the word pain because it really shouldn't be painful significantly. And you're right. Once you get them on the table once, you've got them for life, because it's amazing how good they feel and how they get these weird sensations, and they kind of think it's cool. So they're willing to come back, and especially when they get off the table and how much better they feel. So you're right. It's getting over that initial hurdle. And some of it's a trust issue. Once you get a relationship flowing and people start to trust you, then it's much easier.
Well, we are here in studio on the Dr. Tom Roselle live show with the ASVA board, answering your questions about acupuncture, getting you the information that you might need if you're ever interested in looking up an acupuncturist in the area. One of the things we're also going to discuss, too, is not only how we got into acupuncture, but how the education starts, too, and we're going to talk about that in the second part. Let's talk about how acupuncture works, because people think of that needle. And then, like I said, there's a number of different explanations. And the great thing is that research nowadays, even in the medical community, wants to figure this out as well, too. They've seen it work for so many conditions, but there's not a defined way that it particularly works. So we're going to talk about two different aspects of this. We're going to talk about the Chinese medicine theory and aspect of how acupuncture works in the body. And then we're going to kind of give it the modern spin to explain what might be happening on a physiological session that people will be able to understand under modern-day terminology. So, Sarah, will you talk about the Chinese aspect of it?
Yeah, so the Chinese believe that our body is made up of energy channels called meridians, and in order for our body to function in harmony, those meridians the energy needed to flow through those meridians clearly and smoothly without any blockages or obstructions. And their whole reason for disease is that there are blockages in those channels. I think everyone's daily lives, we drive and you encounter stress, you don't always eat the right foods, you're not always, you get upset about things. So all of these can cause imbalances and blockages in your channels. And then you can go to a licensed acupuncturist, and they can go through a review of systems. Each channel corresponds to different organs in the body and corresponds to different symptoms, so they can look at the patterns, what you have going on, and find out where those blockages are. You can use acupuncture needles. You can also use massage and other herbal medicine just to clear those channels and recreate harmony in the body.
When we look at it from a couple of different ways, from Western medicine and more modern-day technology, some of those same kind of blockages and ideas may seem very different, but they're really not. I mean, we talked about stress, and you brought up the outside environment. We all know that the outside environment can have an effect on us. We just think about the weather. As soon as that changes, we feel a difference. Do we catch a cold quickly? Do we get stiff in our joints quickly? So there's a lot of different things that we know can affect us from the outside. How does stress affect us? We know that stress can be one of the main causes of hypertension. So by decreasing stress, that can be one of the first things that basically kind of helps calm the system down, and acupuncture is great at that. So we look at other ways that research has gone in and said, how does this actually work? What's the mechanism of action, as they would say, if you were looking at a pharmaceutical? And basically what you're looking at is opening up the nervous system and getting more blood flow also from the cardiovascular system to traumatized areas, to basically the nervous system to release hormones and decrease inflammation in the local area, or to get different organ systems to function better. If you can improve blood flow to, say, the stomach and the digestion, you're going to be able to open up and be able to digest and process things much better. We're going to take a quick break, and then we're going to be back. We're going to talk more about acupuncture here on the Dr. Tom Roselle Live Show.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back to Dr. Tom Roselle Live. This is Dr. Stephanie Pina, and I'm in studio live here, and we basically have the Acupuncture Society of Virginia board members here today answering any questions about acupuncture, and we're going to go through and kind of increase your knowledge on this subject because it's one that comes up on this show many, many times, and usually it's just me and Dr. Roselle having that conversation, but today you've got some experts here, so I am hoping that you're going to call in. The number again is 888-630-9625. and we're going to answer those questions for you as well. Now, I led off the show by basically telling you what the World Health Organization said that we treated with acupuncture. I want to actually hear from the acupuncturists what they tend to see in their office and what they typically kind of see people coming in for on a chronic and acute basis as well, too. So, Sarah, tell me about that.
One of the things that I really like about acupuncture is that it does treat so many different things. So every day in the practice is different. One of the most common things I treat is pain. Acupuncture is well known for being able to treat pain, both chronic and acute. I see things from low back pain, shoulder pain, headaches. I get a lot of people who have a lot of upper back pain just from sitting at their desks all day, working on computers, sitting in their cars, and acupuncture is really great at relieving that. I also see a lot of mostly women for fertility. Acupuncture actually can work really well, whether they're trying to get pregnant naturally or doing other reproductive techniques like in vitro fertilization. Usually there's been studies done that shows that acupuncture can actually help the outcomes of that. Another thing that I see a lot, especially in this area, is just stress and anxiety. A lot of people are just busy and overwhelmed, and they start not being able to sleep well, just not feeling very good or like themselves. Acupuncture tends to work very quickly and well to get them feeling like themselves again.
And Sarah, I have one of the stories. I don't usually treat infertility like you do. It's not one of the things I see routinely, but I was working with a patient this summer just to get her body ready. She had planned to get pregnant around now and this, towards Christmas time. And we were just working to get her tuned up and her body cleared, and she was pregnant within a month and was like, whoops. So it does work. So one of the types of things that I see a lot of tinnitus, ringing in the ears, a lot of sinuses. I have some regular patients that when their sinuses kick up, they come see me. And we calm that down. A lot of chronic fatigue, fibromyalgia, those kinds of things. And of course, the anxiety, insomnia, big one, insomnia. And one of the other things that I've found really good results with is sugar cravings. There are several protocols, like the NADA protocol and whatnot, that deal with addictions and cravings and dependency. And the sugar cravings go away very, very quickly. I find that it's amazing, and found that out accidentally.
Carol, what do you see typically in your patient? What type of population is coming in, and what are some of the things that they tend to see over and over again?
It's funny, if you've been practicing for a while, you start seeing patients that you're good at, and also that you want to learn with, and started seeing patients with cancer or have history of being treated for cancer, and so it helps with their immune system and their And we also see a lot of things that the doctors that hasn't been moving for them. So a lot of things that the doctors aren't really sure of, and they can't quite diagnose and treat too well.
Joni?
I see a lot of pain patients, same thing, headaches and backaches and knee pain. Obviously stress and anxiety, because if stress makes everything worse. So once we can get the emotions and the busy mind calmer, the pain tends to be easier to treat. I also treat pregnant women who are wanting to induce naturally, and that's very effective. Also, breech presentation. Acupuncture has been effective in turning breech babies without having to use Western medicine. TMJ, again, a lot of the things that you've all said.
Well, we've all basically kind of heard from different aspects of it, and we've talked about it over here on this show multiple times about how it can be its own system by itself. So that you have a patient that comes in and they've tried everything and they don't want to do pharmaceuticals, they don't want to do surgeries, they come in and they're basically looking either for relief from pain or they just don't want to take the pharmaceutical part. They're trying to get rid of the side effects too. You see that a lot with chemotherapy patients and the nausea and the side effects that they have with that. In fact, that was one of the first things that get covered under acupuncture for insurance for a lot of different places. So, and pregnancy pain.
I just wanted to add one more thing. One of the reasons that got me into acupuncture, and I hate to admit it, but I was a long-term smoker, and I stopped smoking with 2 sessions of acupuncture. So that's something that I'm very, very happy to help people get over.
Well, it's amazing because you do see a lot of practitioners and patients start to get in after they've had treatments and really seen what acupuncture can do for them. They don't know exactly what it's doing for them, but they know they've seen results and they feel better. So we're going to take a quick break, then we're going to come back and we're going to talk some more about acupuncture and how it can be applied to the body to help out with all your health needs.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back to Dr. Tom Roselle Live. This is Dr. Stephanie Pina, and I'm sitting in for Dr. Tom Roselle today because he is out educating, and that's the same thing that we do here every single week. And today's topic tends to be about acupuncture, which is not only near and dear to my heart, but also the 4 other acupuncturists who happen to be sitting in studio with me. They are representing the Acupuncture Society of Virginia. This is the board, so you're talking to the people who are making things happen this time, and they'll be more than happy to take your questions. If you want to have any questions answered, you can give us a call here at 888-630-9625. Again, that's 888-630-9625, and we'll answer anything we can. Now, we're going to change topics just a little bit because all about access to acupuncture, and that has to do a couple of different little subjects. What happens when a patient wants to come in and has some questions about it? And then who are acupuncturists? Why are they trained the way they are? And what goes into the person that you're meeting there, that you're trusting your health in their hands, and basically they've got sharp metal needles, unfortunately, that they use as their tool, just like a dietitian would use supplements, just like a chiropractor would use their hands to manipulate. Ours is just a tool to help your body start to heal properly. So I'm going to quickly throw this out. I want to learn about the acupuncture education. I want to see why are we trained the way we are, and what kind of training does an acupuncturist tend to have? Kathy?
Sure. One of the things about acupuncture schools is they're usually at least a 3 to 4 year program. So it is as long as a medical school. And the school I went to Zhengdao School of Classical Chinese Medicine. In the first year, we studied Chinese diagnosis. The second year, we studied Chinese diagnosis, Chinese treatment, and then in the clinics we did an internship. So on top of that, it's not just the Chinese stuff we have to study. We had to take anatomy and physiology, pathophysiology, and a separate course on musculoskeletal landmarks. So the training is in Western physiology and anatomy is just as thorough as it was in my nursing school, pretty much. So we get that both back Western and Eastern, so that we are trained where the muscle landmarks are. We know how to do treating anything that goes musculoskeletally, as well as systemically through the organ systems.
So we know that licensed acupuncturists typically are going to a 3 and 4 year college.
Exactly.
It's a master's level degree, even though certain colleges right now are opening up doctorate level, especially for people who want to specialize, and also for basically people who want to get into the research aspect. So that's really needed because Western medicine's looking at that research part. But unfortunately, with acupuncture, where you have individualized treatment, nothing always fits into a protocol just perfect. So when you have patients that come in and ask you, what's your education, you're seeing the Western side, you're seeing the Chinese medicine side, and it's our job to basically kind of put that together and come up with a treatment plan for you that addresses the whole body and not just a bunch of random symptoms that seems to be addressed by either medications or surgery and stuff as well.
And I think when you're talking about the doctoral preparation, it's a really huge step for us because that's where the research starts to come in. And now that doctoral prepared education programs are happening, then we're going to have to start doing some really in-depth research. And it is a different paradigm. So fitting it into double-blind placebo control is not that easy when you're dealing with a qualitative versus a quantitative system. So it does have some external challenges. But when you can get something that's reproducible, which is happening, I think we're going to have much more credibility with those doctoral programs.
Absolutely. And we also know that in those programs as well, too, there's herbal training. Not all acupuncturists have training in herbs, but when they do have training, that's additional time. It's an additional national board exam that has to be done in order to get licensed. And when you're getting in those programs, you have to start learning about drug-herb interactions, which is important for anyone in healthcare provider who's going to be working with a patient, because you know that patients are coming in with a list of, 5, 10, almost 20 drugs or medications by the time you put the supplements in there at the same time that they've, heard was the newest, greatest thing to take. How does that all go together? And then you have to know, if you're going to give herbs, you have to know how you want to base it up. How do you treat that patient? So like I said, Chinese medicine is part of a bigger system that incorporates not only what we use on the outside of the body, but what's also on the inside of the body. Now, what's also interesting, too, is the dietary part of it, which has got some similarities to the way we talk about maybe gluten sensitivity and how different foods react wrongly in the body. Do you want to basically answer any questions about kind of some of the basics of that dietary, how it might be different than, say, if someone was going to a registered dietitian?
Well, the Chinese look at diet the same way they look at everything. They look at it individualized. So they could look at a person and say, okay, that person is more of a cold type of person. This person's more of a warm type of person. And then there's certain foods that have those qualities, like warm qualities, cold qualities. There's certain foods that treat different channels. So when the person comes into an acupuncturist and gets evaluated, the acupuncturist can tell them specifically, maybe these foods aren't that great for you right now, and these other foods are better. And someone else who's having the same symptoms may come in but have a different presentation. So it's just a much more individualized way of looking at the diet. Western seems to be more just, if you have gluten sensitivity across the board.
Okay. The interesting thing about, let's say, gluten sensitivity, because that is like a buzzword these days. Everybody's getting gluten sensitive and whatever. That 4 patients could come in and they would all be gluten sensitive, but it would be for different reasons under Chinese medicine, right? The symptoms, they all need to be off gluten, but you might treat them with different types of diets. On top of that to help them heal, because they do present with other symptoms, and it doesn't have to be from the same thing. Just like with headaches, not all headaches are the same thing. We're not going to treat them all the same way.
Exactly. So what you really see is an individualized system that you have to treat the person that's in front of you, and you treat them multiple ways. Just like when we talk about whether or not they need to exercise more or change their diet up, the same kind of principles applied even though Chinese medicine's over 3,000 years old. They had to work with what they had. I always remember one of the things that I was trained in is that basically Chinese medicine came about from 3 different aspects, and one had to deal with food, one had to deal with war, and one had to deal with procreation. And when you thought about it, that kind of covers a lot of different things of why people come in here and just different terminology. So with the food aspect of it, they didn't know if they were going to eat. They didn't know if their food was contaminated. They had to figure out a way to supply their own energy sources. So acupuncture had to address the spleen and the stomach and kind of get things digesting and work with what they had. And that's where diet therapy comes in. They had to address with war because they were constantly fighting. They were in battles. They were being invaded. So when you dealt with that, you have troops that need to heal. You need to get those troops healthy and wealthy. They need to do that. So those troops can be our everyday people that we have now or the most elite athlete. So you have to get them functioning, get their performance up. And of course, funny thing is, you wouldn't think we get a lot of people for the procreation part, but anything anti-aging, fertility, that get up and go drive in the morning, you've heard it more than once on this show. We've talked about it. So essentially what's happening is they want to be able to live the life they want to live and not have anything hinder them. They don't want to have healthcare issues basically get in the way. Now, I'm going to kind of change subjects just a little bit because, patients come in, they've heard about acupuncture, what it can do, but sometimes there's some common questions that come up, like, say, with their first treatment and essentially where they go forward from there. So why don't you ask real quick, Joni, like, what's one of those questions?
Well, one question that a lot of people want to know about is whether or not insurance covers acupuncture. And while most acupuncturists don't take insurance on assignment, they do offer what's called a super bill, and that is something that a patient can take to their insurance company and get reimbursed according to their plan. So I always recommend that people check with their insurance carrier first, find out if they are covered for insurance or for acupuncture and what kind of reimbursement they can expect. But also a lot of people use what's called their FSA, flex spending account, and they put a certain amount of money away at the beginning of the year or aside, and they can use that for a number of different medical uses, including eyeglasses and dental. So a lot of people use their FSAs for acupuncture.
So everyone kind of relies a lot on their insurance, but they need to really check with the providers. And also that's a great way to open up to your employers about other healthcare tools that can basically make you more functional at work, if anything. If you turn it back on them, and sometimes it works better. Essentially, there's been studies that have shown that acupuncture has decreased the cost of people being out of work with low back pain, with stress. There's a lot of different things. So if you think about even just keeping proactive as far as you're at the job work and not missing time out, acupuncture has been used in those aspects too, and they've done multiple studies to show how cost effective it can be for treating a number of different diseases and stuff as well. We're talking about acupuncture today here on the Dr. Tom Roselle live show. There are many things and many aspects that are considered questionable in this realm just because the definitions are different, just because we don't understand what's going on. But acupuncture overall has more and more of a response rate every single day. There's more information out. And I just want to read a list off of people who you might want to be just like. Robert Downey Jr., Jennifer Lopez, Penelope Cruz, Gwyneth Paltrow, Matt Damon, Sandra Bullock, Sheryl Crow. There's an acupuncturist who treats 40 NFL players as well too. All those people get acupuncture. They have come out of the woodwork and said they are in support of acupuncture. So this isn't just available to everybody, but people are definitely starting to see the thing. And a lot of the times, I think Sandra Bullock was the one that actually puts it in her contract when she does a movie that she has to have acupuncture 3 times a week. So she recognizes what's going on with acupuncture. Why shouldn't you? So we're going to talk some more about acupuncture. And basically what I want to talk about, too, are when it comes down to it, and we talk about the needle itself, one of the things that happened, back in, I believe it's the early 80s, is that people worried about the safety risks of acupuncture, what's going to happen. In the early 80s, they came out with what they called a clean needle technique, which basically was a rule that all licensed acupuncturists have to essentially use, and they have to go through this class in order to get treated and trained and get their license. And what happens is that they have to, pretty much in the U.S., use disposable needles. So it's one-time use only, stainless steel needles. So it's not like surgical equipment that gets redone over and over again that can be autoclaved and sterilized. But we see different issues come up, and that's when a qualified acupuncturist is really important, because you want to make sure that you know someone that's doing what they're doing. And that's where we go back to the training. So as far as safety factors, there are definitely some things that we need to kind of demystify.
Exactly. So one of the safety factors is about deep needling, right? It's like, how deep can you go? And that's a really big thing in our training. Is there are certain areas of the body where you can go pretty deep, like in the buttocks, and you can go pretty deep into the muscle. And we do that because we know what's in there. But around the lung, you've got to be very careful, because you only know how that there's a lung under there, and you can't go too deep. So those safety issues come up a lot, and patients ask you those questions about what happens if you get too deep, and the training that we get makes sure that we don't.
Okay. Well, we have a caller on the line. We're going to talk to Al. How are you doing, Al?
Okay. I'm having a problem with my feet. First thing I noticed was a discoloring of both feet and ankles. The primary care physician thought it might be circulation, referred me to a vascular specialist who said it wasn't a vascular problem. I then went to a podiatrist who took x-rays, no structural problems, gave cortisone shots, no help there. Suppression socks, no help there. Eventually gave me pain, pills. Then I went to an orthopedist who said that, well, if the x-rays show nothing and cortisone don't help, he can't help me. So I was wondering, could this fall under an acupuncture?
Well, you know what's great, and I think Joni was the one that said this earlier, is that acupuncture is really great at treating the things that no one else seems to be able to treat. And essentially, with foot pain, too, the good thing is that you got it ruled out as far as from a Western medicine standpoint. Can you tell me, did the feet feel colder than the rest of the body where it's also discomfort?
A little bit, but mostly it's when I wear shoes, just the touch of the top of the shoe to the top of the foot creates the irritation and pain. Underneath the foot is fine.
Okay, so just on that top where it's actually touching the shoe is where we have most of the issue.
Right.
Okay. Anyone want to comment on it, or I'll comment?
Go ahead.
Well, one of the things that acupuncture is going to do is increase circulation, but it's going to be differently than what the vascular surgeon is talking about. So he's looking at the integrity of those blood vessels. Is the blood able to get back and forth through there? And sometimes when there's also issues, you will see discoloration in the area, but you also see swelling. Usually you kind of feel pain and stuff in the whole foot as well, too, because that circulation is going all the way down to the bottom of the foot instead of one particular area. Some of the other things that they ruled out as far as the nerves in that area, too, may not be necessarily related to how the nerves are firing, but there may be inflammation that's related to that area. And we've seen with shoes, too, sometimes poorly fitted shoes can actually do it. So acupuncture can be used not only locally, but to help out with circulation throughout the rest of the body to basically kind of help get blood flow down there and also help relax the muscles that might be blocking some of that circulation as well, too. So excellent question, Al. Thank you for calling in. And essentially, we're going to continue talking about acupuncture in just a minute, and we'll be right back.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
And welcome back to the Dr. Tom Roselle Live Show. We're here talking about acupuncture today and getting all your questions answered and all the information that you need to know why acupuncture might be good for you. Now, we talked a lot about how pain tends to be the first thing that drives in, but we really treat the whole body. We treat the cardiovascular system, we treat the nervous system, we treat the digestive system, we treat it all. And I can't emphasize that more. So if you're ever interested in seeing what can happen with an acupuncturist and what they can do for you, you definitely want to get in touch with one. But one of the aspects that we didn't talk about yet was basically how it might treat the mental, emotional side of it. So go ahead and talk to us a second about that.
Certainly it works with physical pain, but it's very much related, very much connected to the emotional and mental state as well. And at the moment, unfortunately, we have many men and women who are coming back from war with battle scars, not just physical, but mental and emotional. And I have the great privilege of working at Fort Belvoir with the Warriors in Transition Battalion, and I'm able to, with just very 25-minute sessions once a week, help soldiers who are recovering from those wounds. And every week someone tells me that it's the most relaxed they've felt in years, if not in their lifetime. They're able to sleep better. Their physical pain is going away, but most importantly, their anxiety is being relieved.
We all know how important that stress and the emotional side of us does help us treat, because if we do have things like depression and stress, it's going to slow down the healing response no matter what's going on in our lives. It's one of those outside sources that we always have to deal with. We're almost at the end of the show, but I want to actually ask these acupuncturists one last question. What does acupuncture mean to them, and what is it to be basically an acupuncturist?
Again, I feel very privileged to be able to do what I do. I love being an acupuncturist. And to me, it is the medicine of the past, it's the medicine of the present, and the medicine of the future.
Carol?
Yeah, I'd say it's an acupuncture. It is a privilege. it's an integration and commonly a transformation of who we are in the world with who we are internally. Yeah.
And for me, it's a way for me to tap into the entire energy system of the body. Working Western and Eastern, it's a way for me to put it all together and balance that whole.
Yeah, and for me, I would say definitely it's just bringing your body back into balance. I've had so many people say, I feel like myself again, and I think that's one of the greatest things about acupuncture.
I think after listening to the show, we all understand that acupuncture can be much more than that little needle that we think of. It can be a whole system in itself and can be used along with everything else that you do. It's really the wave of the future, and it's getting you more involved because the treatments are individualized for you. Whether or not you need to come in and treat something or you're looking to do preventative medicine, acupuncture patients not only are sick patients, they can be healthy and well as well. So you want to basically get as much information about this and any other healthcare that you might be interested in. Ask those questions. And the show like this, Dr. Tom Roselle Live, is where you can have that asked. I want to thank everyone that's on the ASFA board here today and thank them for coming out and giving us their experience and your knowledge as acupuncturists, but also as patients as well, too, being part of the Western medical system and also being able to incorporate that into the Eastern medical system as well, too, because more of that needs to be done and more of that information needs to get out to the public so they can truly understand the power that acupuncture can have. I also want to thank Dr. Tom Roselle Live for allowing us to be on here. He should be back next week, and essentially he'll be back from his educational teaching tour, as I said. For now, what we're going to do is we're going to start to say goodbye, but I want to thank everybody for calling in. There's a couple calls that we didn't get to, but know that acupuncture can treat more than pain. You have to make the decision to contact the people and get well informed. So thank you for coming out. Dr. Roselle is going to be here next week, and I want to just leave you with being healthy and safe, and think about health. Think about how you can make those decisions that are going to be beneficial not only for you now, but also in the future. Thanks.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.